This is Gina from RN2 Professors with a video for you from my medical surgical series on acute respiratory distress syndrome. In this video, I'm going to review questions on ARDS. These questions focus on assessments and interventions for patients with this condition. I will show you how to determine what the question's asking, how to get the correct answer, and explain the rationale for both. Let's review. Here's our first question. The client with ARDS is transferred to the intensive care department and placed on a ventilator. Which intervention should the nurse implement first? Number 1, confirm that the ventilator settings are correct. Number 2, verify that the ventilator alarms are functioning properly. Number 3, assess the respiratory status and pulse oximeter reading. Number 4, monitor the client's arterial blood gas results. This is an analysis question. This is also a priority question. It's asking you what to do first. Review the ABCs, Maslow's, and the nursing process to determine the immediate need and the correct answer. To do this, you will first read through the question looking for the keywords. The patient is transferred to the ICU, so this is an admission. The patient has a diagnosis of ARDS and is on a vent, but is in no apparent distress. Knowing this, what would be the first thing that you would do on admission? Let's read through the answers again. Number 1, confirm that the ventilator settings are correct. Number 2, verify that the ventilator alarms are functioning properly. Number 3, assess the respiratory status and pulse oximeter readings. And number 4, monitor the client's arterial blood gas results. The correct answer is number 3. Assessment is the first part of the nursing process and is the first intervention the nurse should implement. So why are the other answers incorrect? Confirming ventilator settings, verifying alarms, and sending blood gases are all things that you would do for a new patient. However, assessing the patient is the priority. Remember, if the patient is not in distress, we must assess. Here's the next question. The nurse suspects the client may be developing ARDS. Which assessment data confirm the diagnosis of ARDS? Number 1, low arterial oxygen when administering high concentration of oxygen. Number 2, the client has dyspnea and tachycardia and is feeling anxious. Number 3, bilateral breath sounds clear and pulse oximeter readings is 95. Number 4, the client has jugular vein distension and frothy sputum. This is an analysis question in the assessment phase of the nursing process. You know that because the question is asking you about assessment data. To answer this question, you need to know the signs and symptoms of ARDS. While looking at each answer, determine if the data shown is related signs or symptoms, if it's normal, or are they related to something else. This will help you decide what is the correct answer. Keeping this in mind, let's read through the answers again. Number 1, low arterial oxygen when administering high concentration of oxygen. Number 2, client has dyspnea and tachycardia and is feeling anxious. Number 3, bilateral breath sounds clear and pulse oximeter reading is 95%. Number 4, the client has jugular vein distension and frothy sputum. The correct answer is number 1. A decreased arterial oxygen level while administering high levels of oxygen is a classic sign of ARDS. This happens because the oxygen is unable to cross the alveolar membrane due to a buildup of fluid in the alveoli. You can eliminate the other options by analyzing the data given. Number 2 has general signs and symptoms that could be attributed to any respiratory disorder. Number 3, because this is normal data. And number 4, because jugular vein distension usually occurs with heart problems. Next question. Which assessment indicates to the nurse the client diagnosed with ARDS is experiencing a complication secondary to the ventilator? Number 1, the client's urine output is 120 milliliters in 4 hours. Number 2, the pulse oximeter reading is greater than 95. Number 3, the client has asymmetrical chest expansion. Number 4, the telemetry reading shows sinus tachycardia. This is also an analysis question in the assessment phase. However, in this question, you'll be focusing on signs and symptoms of possible complications. The word complications point to an answer describing abnormal, unexpected, or life-threatening data. Read through the answers again, looking for this type of data. Number 1, the client's urine output is 120 milliliters in 4 hours. Number 2, the pulse oximeter reading is greater than 95%. Number 3, the client has asymmetrical chest expansion. Number 4, the telemetry reading shows sinus tachycardia. Number 3 is the correct answer. Asymmetrical chest expansion indicates the client has a pneumothorax, which is a complication of mechanical ventilation. The other answers are incorrect because number 1 is a normal urine output. Number 2 shows adequate oxygenation. And number 4 is not an indication of a complication. It could result from many different things. Here is the next question. The healthcare provider ordered stat arterial blood gases for the client diagnosed with ARDS. The ABG results are pH of 7.38, PaO2 of 92, PaCO2 of 38, and HCO3 of 24. Which action should the nurse implement? Number 1, continue to monitor the client without taking any action. Number 2, encourage the client to take deep breaths and cough. Number 3, administer 1 ampule of sodium bicarbonate IV piggyback. Number 4, notify the respiratory therapist of the ABG results. This is an application question in the implementation phase of the nursing process. You'll need to apply your knowledge of arterial blood gases to determine what the correct interaction is. The first thing that you will have to do is interpret the ABGs given in the question. Once you have the results, read through the answers again. Number 1, continue to monitor the client without taking any action. Number 2, encourage the client to take deep breaths and cough. Number 3, administer 1 ampule of sodium bicarbonate IV piggyback. Number 4, notify the respiratory therapist of the ABG results. Number 1 is the correct answer. These arterial blood gases are within normal limits, and therefore the nurse should not take any action except for to continue to monitor the client. The other answers are interventions for abnormal blood gases. Number 2 is the intervention for respiratory acidosis. Number 3 is what you would administer for metabolic acidosis. And number 4, the respiratory therapist does not have to be called for a normal ABG. This is our final question. Which medication should the nurse anticipate the healthcare provider ordering for the client diagnosed with ARDS? Number 1, an aminoglycoside antibiotic. Number 2, a synthetic surfactant. Number 3, a potassium caton. Number 4, a non-steroidal anti-inflammatory drug. This is an analysis question in the planning phase of the nursing process. To answer this question, you need to know the pathophysiology of ARDS and the desired effect of the medication. What does it do, and will it help this patient? Keeping that in mind, read through the answers again. Number 1, an aminoglycoside antibiotic. Number 2, a synthetic surfactant. Number 3, a potassium caton. Number 4, a non-steroidal anti-inflammatory drug. Number 2 is the correct answer. ARDS is a problem with the lungs. Surfactant therapy may be prescribed to reduce the surface tension of the villi. The surfactant helps maintain open alveoli, decreases the work of breathing, improves compliance, and helps prevent atelectasis. What about the other medications listed? Number 1 is an antibiotic, and you wouldn't need an antibiotic unless the patient initially had an infection. Number 3 is used to remove potassium in the bloodstream. And number 4 is an NSAID and is under investigation for treating ARDS because they block the inflammation response. So it's not the most appropriate medication listed. That's it for our review today. Thank you for joining me. If you like this video and want to see more, click like, subscribe, and the notification bell below.